we were told that the HIV is not curable. You can't be cured by taking this medication, but for now it comes out like we want to cure them, the HIV virus. But the worry is that is the community going to be positive with the curing? Then we had question 3. We say yes. Then the first, can someone please okay. Because we said yes, we said for the firstly, we need to advocate our government to be involved in the ongoing HIV cure research. Number 2, we have to sensitization of the people living with HIV, healthcare workers, etc. Then number 3, we need to have the piloting. So that is all that we managed to collect for now. Thank you.
Thank you. Thank you. That's great. So let me quickly just respond to a couple of things up here. So the question around what is the HIV cure medication to be taken once? So this also relates to the what you call freezing, remission. Think about, do you remember the last slide, Tumbi? And we'll share the slide so you can see. Do you remember the last slide basically had, at the top was a short bar that showed current ARV treatment, and then there was a longer bar that said long-acting, and then there was another one that said broadly neutralizing antibodies, and then at the bottom it said single-shot cure, right? So the idea in terms of, it's not a choice like, do you choose remission or do you choose gene therapy for an eradication strategy? Because it depends that what we're able to find that works, right? And so if we end up with a solution that says, well, come in once every 2 years for some treatment, and if that's the best we're able to do, is that a cure? Well, we can debate that, but it's better than what we have now. If we end up with a gene therapy that allows you to go in, you have a single shot, and that's done, and it gives you immunity to reinfection, even better, right? But the reason why both strategies are being followed is because it's uncertain, and we have to explore every option at this point, okay? So that kind of answers why the goal, the ideal, is once and done. We may have to do it repeatedly. And and we do hope, if something that comes out of this is that the community wants to do more, then and if training trainers is something that's what comes back as the request, then we and hopefully others will help try and support that. Wonderful. Thank you, Group 4. Well done. Next group. Got a group in the back there. Oh. Come on up.
Sanbonan. So we have this question, the availability of resources for training and advocacy in terms of healthcare workers, because at some point if we come with much information to them, they will feel like we know everything. So we have to educate, teach them, and people at some point, they would love to see a nurse speaking about these things. Then a role of people living with HIV in HIV cure. How can they participate in terms of involvement, We also talked about question time frame in terms of enrollment. When are we going to enroll the HIV cure? Because we need a time frame. We can't just talk about HIV cure for the next 20 years. Let's talk about time frame, targets, and who are the targeted people. Mechanism to put in place towards HIV cure program, role of government and partners. I think these are the key stakeholders in terms of health issues. Government have to be there, especially the Ministry of Health, because we can't just go around and talk about HIV cure without support, because they have to support in terms of infrastructure, they have to support in terms of transport maybe, they have to write letters that will enable you to go maybe to a facility where you will talk about or advocating about HIV cure. And partners, they play a very important role as well, because they support in terms of finance and otherwise. Collaboration between traditional healers and modern cultures. There is always a clash when it comes here. At some point we feel like as Africans, our inputs or our thoughts, they are not mattered that much. That's why at some point people even today they are not on treatment, they depend on traditional healers. So we need a collaboration between traditional and the modern, and see how best can we improve for the sake of people living with HIV, because at some point we feel like they are fighting with us. Traditional healers, they will come with a different information when it comes to HIV, and the modern, they will come with a different information. Then you will find yourself confused and you will think, you know what, let me go for this one. While they can sit down together maybe and see how best they can do it. Then we have hopes. When is the HIV cure will be available? Is it accessible? Itaba free, availability, I could say itaba available in. HIV cure eradication at affordable price. At this moment, government is offering free ARVs, through the help of international donors. Yes. I think it's the same sentence, this one. Then Emma worries, because it's a new thing, you have to be worried. So start HIV cure without training, full information. Is it the information approved? Government is ready to be engaged, to commit in participating in terms of resources. What will be the barriers? Sustainability, effective of the HIV cure in terms of reinfection and so forth and so forth. Correct, verified information. Will people living with HIV participate in the new program? Thank you.
It's a tag team effort.
Okay, this is we were supposed to do question 2, which is talking about how is this program going to reach the community? What challenges are we foreseeing? So we discussed and came up with the following. We foresee resistance to HIV cure. We are looking back at from where we are coming from. When ARVs came, there was a lot of resistance because people lack information. With the lack of information, people were not taking ARVs as expected. So the ARVs were there and people were not taking them, and there were a lot of things were happening, like people continue to die because they were resistant of taking ART. We also looked at strengthening of the treatment literacy that will include HIV cure. Right now, as we were discussing there, we also looked at the issue of EU equals to you, that it is not known in the community. Only us maybe who are involved in these issues of people living with HIV. But when we are with these people from the Ministry of Health, once you start talking about you equals to you, they're saying no, this one should end here, because once the people in the community knows the information and they start giving reasons of what is going to happen. So for us, as we were discussing, we realized that it is very important that we go as far as talking about you equals to you, and we then felt like it is an entry point to HIV cure. So on the other note, we also felt like the resistance from government to allocate resources and coming up with regulations that are going to cover on how the HIV cure is going to reach, the information is going to reach our communities. So we also felt like there is a need for a comprehensive advocacy training for HIV cure, for activists and advocates, and building relationships with other international entities that support HIV cure. Right now, we have learned from other countries like Kenya that they have already started something, which means as a country, we need to have a good relationship with those, so that we can learn from their own experiences and come up with something solid on how are we going to come up with a very good program that is going to make our people understand that a HIV cure is possible. So on the other note, we also discussed that Africans are comfortable with their own remedies than the modern ones. And on the other note, we also spoke about us who are from the Christian community, that we also believe in prayer other than taking other medications or whatsoever. So that can also be a barrier to HIV cure. We also felt that capacity building for community treatment literacy that include HIV cure for communities. On that one, we also spoke about that now we have got a PrEP, and the community is not clear about PrEP, such that we have learned in one of the trainings of treatment literacy that we have done with other people living with HIV, that some people go for PrEP and then they take those meds and give them to those who have tested positive. They sell them to those. And now, why are people not going to hospital? Why are people taking PrEP? Because with PrEP, we know that it's a combination of 2 drugs. And we are supposed to, if you are HIV positive, 3 drugs. Lack of information. So, treatment literacy or information about anything about HIV needs to be clear to community members, including community leaders, so that the rollout of HIV cure will be successful. Otherwise, we are going to have a problem. We will have the cure, but people are going to resist to take that cure. We also spoke about specific IEC material that is simplified for all ages. It is very important that the IEC material covers every level. You are an adult, you are a child, youth, so it should be friendly. That is going to help us then to be successful in this in this program. So HIV cure champions. We talk about having HIV cure champions putting the face. In most cases, people will ask, why are you talking about your HIV status? I was just putting the face that it's not only the figures that are talking that we are talking about. Sendenjani is living with HIV. So now there is the statistics, then there is a face of Sendenjani who is living with HIV. Same applies when we are pushing this HIV cure. This needs to be done. Also that we felt that we are far behind. The communities are not aware of this information, the U equals to U. So concept. So even then, we need to start now to talk about U is equal to U, so that we will be successful in this HIV cure program that or concept that we are talking about, since we truly believe that U equals to U is an entry point that is going to make us successful with HIV cure. Thank you.
Thank you. Thank you. So that's great. And just on the point about materials, we are working with partners to develop some materials that we hope local partners will be able to adapt for use. It's very hard to do one set of materials for every group, young people, key populations, etc. But we are aiming to at least help develop some materials which are entry level. There is already some material from Uganda which was developed for communities. It's a bit technical, but we can share if you want to study it a bit. But we're aiming to do something that's more entry level this coming year.
Hello, sanibonani. Sing group 1 sithe besihlangene. Sathi after le session yanamuhla, ema questions lesibe nawo lesiwarezile was, what does HCAAP have in hand to support the HIV advocacy? We then said, okay, how do we build from what we learned from today onwards? Today is Funzi, so we have to build and have a way forward. How do we go about? Then Sabat's team, how can HCAAP support the community mobilization and preparedness as Satokulum HIV cure the community? How will the HCAAP support us? The connect mobilizer, the preparation for the community. Then Emma worries was creating demand for something that is not available. We are here talking about HIV cure, but still there is no HIV cure. Then we said, will our government support our advocacy? Then we said, given the country's economic situation, will the country be able to fund the research infrastructure, or will the researchers bring their own infrastructure? Then our other worries is the risk associated with the HIV cure trials. Then it's government's non-involvement of people living with HIV in matters that concerns them. I will then ask my group member to please elaborate on this point.
We spoke about non-involvement of government at conception level when they decide to roll out the HIV cure research. And then what we've noticed ever since is that government does not consider people living with HIV at conception level. And then they also don't involve them at their protocol development, the ethical issues, and also when the government is developing the standard operation procedures for the research. So that is why we are saying that is one of our worries. We all know that as people living with HIV, we are well-resourced, we are diverse. We've got well-resourced people that can participate here. It's not about saying people living with HIV do not have capacity. It's a matter of involving them and making sure that the people that have got the expertise in this field are part of the conception. Thank you.
Okay, thank you very much. Then, our hopes. We are hoping that we have more people advocating for the HIV cure. We are also hoping that the message is well received at community level. I.e., there is a need for the advocates to be more trained on the HIV cure. And we are also hoping that the country will use the same approaches that has worked in other countries. Okay. Then my challenges at community level, it's the level of understanding. It will take time for people to understand the HIV cure, since they've always known that HIV is incurable. There's also the issue of myths and misconceptions. Religious beliefs, cultural beliefs, stigma and discrimination, and also the economic challenges. When we remember when when AIDS was first implemented, it was expensive. So we are having a problem. We see, is the cure going to be free, or we will have to pay for the cure? Then, how can we empower them? We can assure the community members that research will be done before dissemination. Then, with the history of how HIV treatment has been evolving, we will then come back and take references. There was a reference here. In 1996, there were a lot of pills we had to take, whereas in 2001, we are taking only one pill. I hope I made a point.
Thank you. That's great. That's great. And we would wholeheartedly support your point about engaging communities from conception. That's why we're here. It doesn't happen. And just so you know, it's not just in Eswatini that this doesn't happen. It's all over the place, right? So you're not an outlier. Who's going to speak on behalf of Group 3? Don't be shy. There we go. Well done.
Afternoon, everyone. As Group 3, when we were discussing, we came with all of these answers here. Oh, okay. So, the questions which we had as Group 3 was that, does it have any long-term effects? Does the HIV cure have any long-term effects? Like when we have them, are we going to live long enough, or is it going to have some effects? Will it be accessible to all of us? As we know that we are not financially stable, is it going to be accessible for all of us to have at any time? Will it be free? And we also had a question that we also spoke that the people living with HIV must be involved in this program. And then our hopes, we hope the results can be quick and positive. We hope there will be no side effects or complications. We hope the government will approve and also be involved. And our worries, will it be affordable or free for everyone? Will it practically happen to achieve HIV cure? Side effects and complications, how is the community going to respond to it? Is the treatment going to be friendly to all age groups? Are we going to form a network that will interpret the HIV cure at ground level? Are we going to have the same facility to access the HIV cure? Are we going to have enough experts in the country? Those were our worries, which we just discussed about. And then, in question 3, given that an HIV cure is likely at least a decade off, is it appropriate to begin HIV literacy efforts with people living with HIV and communities now? And our answer as Group 3, we said yes, it's possible. But we need programs to begin with, or dialogues. We also need trainings. We can start educating people before starting so that they can be well versed about the program and they are ready to begin treatment as early as possible. If we want to achieve this program, we have to involve the government as soon as possible. We need the involvement and support of partners and donors as well. We need the involvement of people living with HIV and all key populations. We also need the involvement of all religious groups. Thank you.
Thank you, thank you. And one of the things I just want to pull out was the bit about treatment centers. Like, would cure be administered in the same place where treatment is administered? And this doesn't come up very often. It came up in one other workshop, I think it was in Zambia. And the question is, we don't know. we at this point, we don't know. But it would be great to start thinking about it, because I think it's also attached to concepts which have come up a lot around stigma, and you might, in theory, in the future, if you have a cure, have groups of people who are cured, people who are on treatment because either they're waiting for the cure or because they made a choice that they want to just stay on treatment, and then others, you know, who may be negative or at risk or whatever. And what does stigma discrimination look like? You know, where you've got another category of people who have had the cure. So, great, well done, everybody. Really diverse. There was overlap between the different groups, but there was also quite a lot of variance, which is great. So I really appreciate the time and thought that's gone into this. As mentioned, from our perspective, I noticed that what's HCAAP going to do we are trying to do what we can with the resources we have. We will follow up with the network here and to see what we can do to support your ideas. We hope this has stimulated some conversation and thought on your side. And as I said, today's the beginning of the beginning. The next step is for you guys to figure out what it is that you want to do moving forward with the group yesterday. We will be doing some things globally over the next few months. We're developing some cure community materials, which I hope will become available to you guys. They're not ready yet. They're only just starting the process. But over the next, say, the first half of this year, will become available for you to be able to have some of those early introductory conversations. And it'll be very much in the way that Tumbi described, like it's a journey from treatment where we are today to long-acting to new technologies. And then we're also investing in a cure curriculum. There already is a cure curriculum. There've been 2 iterations of it, but we're going to help with the people who developed it, update it, and we're actually also inviting people who have been part of these workshops to be part of that process. So if you're interested, let us know. And that is a self-directed kind of program of study. But what we hope to do is in the second half of this year, when hopefully that curriculum has been updated, is to have kind of maybe like a monthly webinar with people like Tumbi to talk about specific aspects of the cure curriculum. So a bit of self-guided study. And then, as I said, it's what you guys come up with in terms of your plan here and see what we can support. From my side, I would like to give you my deep appreciation for spending the time today, for engaging with the topic, for speaking, for not wanting the breakout groups to end. I appreciate it when people have taken on the content and are interested. I hope it will start a conversation here. And also my appreciation to Precious and the team for all their support and help. Thank you. But I will hand over to you for the last few words. All I can offer is my appreciation and thanks, and you will be hearing from us.
Thank you so much, Dominic, and we honestly want to appreciate as people living with HIV in Eswatini in supporting us and having such a forum. As you are going to leave, we're going to sit a bit and draw our plan, so we'll definitely be pushing you to support some of the things, and we are hoping that you're also going to link us with other possible funding, because we are also looking forward into pushing some of the strategies that we have seen working in the different countries in Uganda and both in Kenya. So your coming here is really going to yield a lot of good results, and just to appreciate everyone in the room for stopping everything that we're doing and coming to this forum in this particular day. And we really appreciate for us for being here, and we are wishing you a safe flight. I know you are rushing to the airport in a few minutes, so we just want to wish you a safe flight. Sorry? I would love to appreciate Ivo. Ivo is my good friend. When we don't have money, he will still come and stream live or do any documentary. Now I'm marketing him. If you want a very good documentary, please get in touch with Ivo Coughlin. And these people, they are awesome. Trust me, they are awesome. So whatever activities and you want to capture, it's good to really capture. They'll talk about your price, but don't lower your standards too much. It might be a problem. So please kindly reach out to him so we document our project so that it's easy for us to get more funding. Thank you so much, Ivo, and your team for being with us for the past 2 days. Thank you so much, viewers, on our YouTube page for being with us, and we are going to be responding to all those different messages and questions that you've been sending. So it's been a very good afternoon in Eswatini, a good morning in other countries. Till we meet again, keep liking our page and sharing for other people to learn. Thank you for the team in Malawi. I know they were watching. There's another team in Kenya and Lesotho and Zambia. They were also on our YouTube page. So we just want to say thank you to those young people that have been sticking online with us. Thank you so much. This is the end of our session.